If you're having autologous breast reconstruction, did you know that there are many different ways that we can monitor the flap in real time after surgery to see how it's doing? The reason why it's relevant to you as the patient is that there might be additional cords and tubes coming out of your chest area that you have no idea what they're doing. So let's talk about the different ways that we monitor a flap. First off, we always look at how the flap appears. Its color, is it swollen? We look at the drains, we look at the incisions, but what we really want to know is how is the blood flow into the flap and how is the blood flow out of the flap? In is artery, out is vein. Now, a physical exam can give us some ideas, but we also want to really hear the blood flow. The first way that we do that is through a Doppler. A Doppler is usually a pencil Doppler like this, and we have found an area on your flap that allows us to hear the blood flow going into the flap. If it's an artery, it sounds like your heart. If it's a vein, it sounds more like a whooshing noise. So that is one way that we or nurses or whomever is monitoring your flap can look at the flap. The second thing is a tool called a Vioptics. A Vioptics is like a pulse oximeter that they put on your finger during surgery. It's the same thing, but it goes on your breast, and it allows us to monitor oxygenation of your flap. The reason why that matters is that the artery and the blood bring the oxygen to the flap. So if the number is stable, that means that your flap is getting good blood flow. Studies have shown that this is actually the most sensitive way to detect a flap that is in trouble. Another way that we can monitor a flap is through a Cook Doppler. A Cook Doppler is an implantable Doppler that goes around the artery or the vein, so actually in your chest. And it's connected to a machine where if we press a button, we can hear the artery or the vein, whatever it's connected to. This is connected to a little cord that comes out of an incision, and it's usually left in place from anywhere from a couple days to a couple weeks and then removed in clinic. The one nice thing about the Vioptics is that it actually can connect with an app on our phones that allows us to monitor the flap in real time from our homes. If you've had a flap, what ways of monitoring did your team use for you? And did they explain to you what they meant? Let me know below.